Advita's guided personalized surgery and its Newton knee technique provides patient-specific planning for a well-balanced knee. To begin, Advita's GPS is placed in the surgical field so your surgeon can access it throughout your procedure. Active trackers are used to accurately track motion during your total knee procedure. Your unique knee anatomy is mapped. The arthritis in your knee is assessed. The cutting guides are placed onto your knee. The tibial cut is performed and validated for surgical plan accuracy. A full-range tensioner is placed in your knee's joint space. Your leg is moved through range of motion, allowing the software to measure and analyze your knee's natural motion. A personalized surgical plan is created to meet the needs of your knee. Your surgeon fine-tunes your plan throughout the surgery. Once the plan has been accepted, your surgeon will perform all remaining bone cuts and validate for accuracy. At the end of the procedure, implants are trialed, your range of motion and balance is validated, and final implants are placed. Experience the patient-specific Newton knee balancing technique and learn more by visiting mybalancedknee.com.